better never ends. In health, in performance, no matter your starting point, you can always strive for better. My name's Charlie Goodchild, I'm your host, and this is the Better Never Ends podcast. We've made it our mission to share with you the expertise and wisdom of role models and leading experts in their field, teaching us about how we can be better, telling stories about their journey to better, and inspiring you to discover yours. Today we're welcoming the lovely Fran Whitfield into our podcast studio today, and Fran is a cancer, exercise and rehabilitation specialist.
Yep.
Used to be personal trainer and focused on strength and conditioning, and changed professions due to quite a big life situation that happened during COVID.
Yeah.
And Fran's going to tell a story shortly, and what we're going to be covering today is a conversation around cancer, a conversation around mindset, and how that intertwines into recovery, and how we're trying to talk about a different way of thinking about cancer recovery and a different mindset, and how that really all links up together. So I think you're best at telling the story, Fran. So if you don't mind,
Sure.
I'm going to stop the introduction at this point and hand over to you to tell your story from the beginning, if that's okay.
Yeah, absolutely. I've been in the fitness industry for 8 years. Started out, as you say, personal trainer, specializing in strength and conditioning. I was very fit and active myself. My sport at the time was endurance. So I was training actually to do Ironman, and I was doing a lot of duathlons and triathlons and races. And then when I was 24, I found a breast lump. So it was just by chance I'd found it. Went to the GP, who then referred me to the hospital for a scan. But then when I went for my scan, she'd actually said to me that I was young, I was fit, I was healthy, I was deemed as very much low risk, no family history of breast cancer, all the kind of things that you do to prevent the chances of getting cancer I was doing. So didn't do the scan and then sent me on my way. So for 18 months, I kind of went along thinking that everything was fine and that it was just this hormonal lump that she had deemed it as for my age. And then in the May of 2020, so during lockdown, I'd actually had an accident training in my garden with a barbell, and I herniated my L4, L5, which paralysed my left leg. So I went in for emergency surgery for that. And then when I was learning to re-walk again and rehab for that, in the July of 2020, a dimple had appeared where my original lump was. I actually didn't realise how big it had grown during that time because it was growing inwards until obviously this dimple had appeared and it was essentially drawing the skin. So because of the fact that it was COVID, there were lots of delays. I went and got a rapid diagnostic test. And 3 days later, it was confirmed that the lump was in fact breast cancer. Thankfully, in some ways, my accident had actually saved my life because the consultant at the time saw that I was on crutches, had asked about my back injury, and breast cancer can typically spread to the spine. So he was concerned that potentially the injury that I had had would be linked. So sent me for a full body PET scan, head to toe. My back was completely unrelated, but they did then find 2 other tumours, one in my skull and one in my liver. So I was automatically deemed as stage 4. The oncologist at the time had said to me that I had 2 years to live. That's what she deemed me as. And only if we could remove the brain tumour would we be able to know essentially if it was going to be the same genetics, and that would mean that I was stage 4. So I did have my brain surgery a couple of weeks later, and they did confirm that it was the same genetics as the breast. So by that point, I was like, okay, someone's saying to me that I've got 2 years to live. There's no treatment that we can do. I didn't want to believe that that was my end route. So I changed hospitals, found a new oncologist, and then we very quickly started quite aggressive treatment. So I had 6 months of chemotherapy, radiotherapy to my skull after, and shut down all of my hormones. So I got put into a medical menopause by turning off my ovaries, and then 12 months to the date pretty much that I started that treatment, I went in to see whether or not I could have my breast surgery. So we needed to check that it hadn't spread anywhere else. So then I could then actually have the surgery to remove what was left of the breast tumour. But when I went in, my oncologist actually said to me that I wasn't going to be having the breast surgery because my tumor had gone. So the breast tumor had gone, the liver tumor had gone, and there was nothing left in my skull at all. So I had a complete NED, which is what they call it, so no evidence of disease scan. And that's been my story ever since then. So that was in the September of 2021, and then here we are today, and I'm still cancer-free. But the part of that story that changed the avenue of my career was the fact that throughout my entire treatment, I continued to train. I knew that I wasn't going to be able to stop training for my mental health. That was just part of me. But being a bit of a geek, I'd done a lot of research into the effects that exercise has on cancer treatment and the side effects as well, and preventing side effects like fatigue, muscle atrophy. So I used myself as an experiment, essentially, from the day that I started chemo. And I had an assault bike in my flat, various bits of kit, and then exercised all the way through. And when I got the news that I was cancer-free, I said to my oncologist at the time, does he think it's a coincidence that I have remained active all the way through my treatment and we've had this result that no one thought would be actually possible at all? And he said to me then, no, I don't think it's a coincidence. And that was huge for me to have that from him because he's very high up in the breast cancer world. And he's very, very experienced at his job. And from there, I was like, okay, well, I know that people don't know how they can exercise through treatment. I know that firsthand because I've been very open on my social media and I documented my entire journey. And the constant question I'm getting on social media is, can I exercise? Because I'm seeing that you're doing it, but my oncologist has told me to walk or to do some yoga. Can I still lift weights? I want to lift weights. I want to still be able to run. I still want to be able to do the sport that I was doing before. And it was every day I was getting these questions. And so it was very quickly becoming apparent that no one knows how to exercise through cancer treatment, or no one knows how to deal with a cancer patient.
It almost sounds like you didn't really have a choice but to change your specialism.
Yeah.
It was almost urgent.
Yes, yeah. It was very much needed, and there was a massive void that needed to be filled. So I went and got requalified. So now I'm a cancer exercise and rehabilitation specialist is my formal title. And I work full time with people that are pre-treatment, during treatment and post-treatment to educate and help them to then remain active, but doing things that isn't just walking and isn't just yoga. But there is strength training and lifting weights and still doing their cardio and still pushing their bodies to the level that you can still push yourself when you're going through treatment. Yes, it's slightly different and it always will be slightly different from what you were doing before, but we don't need to be wrapped up in cotton wool. And that was my mission when I started this, to prove that. I proved it myself, and I proved that, I had incredible result from my treatment. And so then that was my goal, was to have every single patient that gets diagnosed to know and be educated that, yes, you can still exercise. And it's not just doing down dog.
Yeah. See, your mission and your purpose has just given me goosebumps. It's just come through so passionately and clearly. So why is exercise so powerful for cancer?
So there's kind of two elements of it. You've got the physical element of it, and then you've got the psychological element of it. Mm-hmm. Both, I feel, work hand in hand, to be honest. From the physical point of view, we're seeing more and more now that research is coming out to show that actually your physical uptake of the drugs that you take is better when you exercise, because it helps to metabolize the drugs. So essentially, by exercising, you're helping the drugs actually work better, which, I'd go as far to say was probably what happened in my case.
Today's probably the first time I've heard that before. I didn't know that was a factor.
Yeah, it's a very new, relatively new research that's coming out. Obviously, this is research that's been happening for many years, but it's only now just starting to come out. And I actually first heard about this back in 2021 when I was having a chat with a exercise oncologist over in America, who, that's her job. Her job is to research this. and this is what they were finding. And that was the first time that I'd heard about it. And I thought, then this is incredibly exciting, especially for someone that's in my industry, because then the more research that comes out to prove this, the more it's backing up what I'm trying to say to people and what I'm trying to educate them in as well. And that's just one part of it, right? So you've got the fact that because of that, treatment works better, the longevity of people are better. So we know that exercise is something that you are told to do to prevent your chances of getting cancer. Just because you have already got cancer doesn't then mean that you should stop because it's happened. It actually means you should carry on, or you should start it, because if you then go through your treatment and you get a good result out of it, or even if you're still in active treatment, your longevity is going to be longer because of the fact that you are exercising, because it's still one of those things that they know helps to prevent the chances of those cancer cells growing.
Yeah. And this is what seems to all of a sudden make total sense. Like, exercise is so effective across all domains of health.
Yeah.
So why wouldn't it work?
Exactly.
Cancer as well. Why would we all of a sudden decide to stop one of the most powerful medicines known to Earth, exercise?
Exactly.
Just because we've got a disease, when actually a lot of other illnesses we seem to treat with exercise too. We just haven't seemed to do the same with cancer for some reason. What do you think that might be?
I think a large part of it is an education. I think, I'm not tarnishing everyone with the same brush, but I think there are quite a lot of consultants and medical staff that don't quite understand exercise themselves. So to protect themselves and kind of getting that question of what activity can I still do, instead of recommending that they go and, do a deadlift or do a squat and things like that, they recommend that they go to a gentle yoga class or they go for a walk around the block. Because they don't know. They don't know what I know because they don't have the same qualification potentially, or maybe they don't actually exercise much themselves, so they don't understand exercises in general. I think that's kind of where it starts, is the fact that you hear the word cancer and then you think that someone has to be protected.
Yeah.
And we don't. We can still push our bodies. We can still sweat. We can still lift heavy enough weights if that's what we used to do before, or even if you didn't lift weights before, you can start lifting them now. And you'll see huge amounts of benefits from it, from a side effect point of view as well, with muscle atrophy being one of the key side effects that you get from chemo. So muscle atrophy being the wastage of muscle, and that doesn't just happen from being sedentary, that happens from the fact that actually the toxicity of the drug that you're taking, or you're having to take, or that's getting injected into you, is causing your muscles to break down, essentially. So from a maintenance point of view, we need to lift to maintain that. But they don't understand that, or a lot of them don't. And that's a full admittance as well. I've done talks within hospitals and it has come out that they just don't understand that. They don't know that. So there's a big movement and a big drive now to educate from within. Because if we educate from within and we kind of educate the clinicians and the nurses to understand this is actually the kind of exercise that patients can do, then that's when it then spreads out. So when your patient comes to you and says, what can I do during treatment, instead of getting the recommendation of walking and yoga, they can actually get the recommendation of, oh, here's a cancer exercise specialist. Now you can work with them.
This is the same within my field as well. So I, as a musculoskeletal physiotherapist, I work alongside orthopedic surgeons regularly. That's a normal part of my job. I'll refer patients to them. They refer to me, and it's the ones I work with closely are the ones that I've tended to find don't tell me what to do as an exercise specialist. They just do their job. They diagnose, they investigate, they clinically reason, they operate, and then at the point where the person needs to recover, they send them to me. And that works well because I'm the specialist within the exercise world and they're the specialist within that medical field, that orthopedic field. And what sometimes happens when it doesn't work out so well is when the doctor thinks that they know the exercise world and they tell you what to do as a physio, and it just does, the trust breaks down, even just for me, let alone the patient, because then I'm having to tell the patient, actually, that's not quite the right way of looking at it. We need to look at it differently. But when it works best is that we're not hierarchical with the doctor sitting up on the top of the pedestal. We're sitting alongside each other in different worlds, and you're the exercise specialist here. and they're the medical oncology specialists. And
Yeah.
that's where it seems to be working, and potentially that split hasn't been made so well in the world of cancer as it has done in orthopedics. So you're fighting that fight, right? Which sounds great.
Yeah, I think it's it's definitely a new thing. Like I know still a lot of people don't know that cancer exercise specialists exist. Don't get me wrong, there's not many of us. There's not many of us in London at all. So I am incredibly busy with my job, but there are more and more people coming out now, and I'm seeing it because I do talks for the course that I was actually part of, and so I'm seeing more people actually on the course, which is exciting to see that there are more people coming out and doing this. But also I think that actually the trusts within the hospitals are actually now realizing the importance of exercise being actually a treatment itself. And it's not a treatment that's going to, cure the cancer. That's not all we're saying. It's not treatment on its own. It's an accompanying treatment. Like the treatment needs to go alongside the medical treatment. But instead of just receiving chemo or radio or surgery, you need to receive that plus an exercise program from a prehab and a rehab point of view as well, because we know that if you exercise going into surgery, the outcome of your surgery is going to be a lot better because your recovery is going to be a lot quicker. And there's evidence to prove that. So now they're starting to listen, they're starting to realize, and the more that we kind of see that base curve actually improving with patients going into surgery, having gone through a prehab program, then you can't not listen to it.
Let's break that down a bit then. So we've already briefly spoken about bed rest and if you don't use it, you'll lose it concept. Essentially, we know that that's a very well-known phenomenon within the biology. That
the rest is best is what they used to say.
Yeah,
with
which is absolutely
patients.
nuts. And now we've suddenly flipped it because we understand that doesn't make sense. But what you also said was chemotherapy seems to accelerate the atrophy of the muscle. So it breaks down the muscle, strips the muscle even faster than bed rest itself.
Yeah.
So we've got a situation where there's inevitable bed rest that's going to happen after a surgery.
Mm-hmm.
And then you've got an acceleration of that wasting away from chemotherapy. And then you've got a mindset within the world of cancer of we need to rest rest is best, as you said.
Yeah.
So you're then quite rightly picking up on this concept of prehab, which again exists within orthopedics and pre-op surgery, ACL surgery, one of the biggest, most studied injuries on the planet because it's worth so much money in sports. We now know that there's significantly improved outcomes for people who have prehabilitation, 6 weeks of exercise before their operation. They do so much better.
Yeah.
Who'd have thought it works in cancer too? It's like, why are we suddenly treating it differently when the biology of the human body is the biology of the human body? And if anything, sounds like it's even more pressing that you need it because of the side effects of chemotherapy.
Yeah, that's why I find it so baffling, to be honest, that we haven't dealt with cancer in the same way as you say, things like ACLs and other surgeries that we have. Like, why are we dealing with someone that's going in to have a stoma bag put in because they've got bowel cancer, or someone that's going in to have a mastectomy because they've got breast cancer? Why are we dealing with them differently? It's still a surgery and it's still a recovery time. And so we're now seeing that if you think about that baseline curve, when you're going into surgery, it's obviously going to drop. Naturally, your fitness is going to drop. But if you haven't exercised before and then it drops, you've got a long way to go to then get back up to even just your baseline. Yeah. And it's very hard to then actually get beyond that baseline. Whereas if you go into a prehab program for, as you say, like 6 weeks, and then your fitness actually increases, yes, you're going to have a natural drop off when you go through surgery. We all do. But it's not going to be anywhere near as low as the person that didn't do prehab, which means it's going to get a lot higher very quickly. And then also you've got a higher chance of it actually going beyond your baseline and actually being stronger and fitter post-surgery than you were before. And it works with everything. It works with all surgeries. There's a lot of research into it at the moment with prostate, and there's a lot of prehab programs that I've seen going through for pancreatic cancer as well. We tend to find that pancreatic cancer patients are a lot older, so they kind of need that prehab because naturally, obviously, we know that as you get older, your muscle wastes anyway. So then if you've gone through chemo, you've got that on top of it, plus you're probably a little bit more sedentary. So there's even more importance of that aspect of it as well. And that's kind of why I guess they're focusing the research on those areas to show it. But it works for everything. And I work with a lot of breast cancer patients just because I think they know that obviously I've been through it. So I get a lot of those. But even things like, I couldn't believe it when I heard that there were some people or some doctors that are recommending that post-mastectomy, don't lift your arms above your head. That was one of the things that I've heard quite a lot. And as you say, then you have to break it down and you have to try and argue against that and get the person that you're working with to believe you. And then obviously if I'm then going, no, I'm going to get you to do a shoulder press, they look at me like I've lost it.
But my surgeon said this.
Yeah,
because
exactly.
they still see the surgeon as the top of the pile. Just because we start thinking of it differently in different terms doesn't mean the person in front of you is going to believe that, because society still sees doctors as the top of this hierarchy.
Yeah. And then you break it down to them and you say, okay, well, you've had a mastectomy. What's coming up next? Radio. Okay. So where are your arms going to have to be when you go into radiotherapy? Above my head. Right. So every time you go into radiotherapy, which sometimes is Monday to Friday for 3 weeks. So every day you're going to go in, you're going to have to put your hands above your head. If you come out of surgery and then don't put your hands above your head for 6 weeks, right? Your hands aren't going to go above your head because naturally our body protects ourselves anyway. So we get frozen shoulder. You lack mobility in all of your ligaments, your tendons, your joints. And it becomes incredibly uncomfortable, if not impossible, to actually put your hands above your head for radiotherapy. And all that does is cause delays. And then they can't have radio. And it's happened, and I've seen it. I've seen frozen shoulders because even things like not opening the cupboard with that arm because their surgeon said to them, don't put your arm above your head. So they won't actually use that arm to then open up the cupboard. So you haven't used that joint at all, and then you're expected to then rotate that joint and have it in a static position for 20 minutes or so every single day for 3 weeks.
If you don't use it, you lose it.
Yeah.
Same again.
Exactly.
Muscle mass.
Gone back to the same thing.
Joint mobility, it's the same. And if you don't use it, it becomes incredibly sensitive too, which is why it's really painful to lift. So if it's a fundamental part of your treatment, let alone your everyday life, then why wouldn't you be doing that, even if it's just moving it, let alone lifting weights in that plane of movement?
Yeah. Yeah. So then I get them to do, shoulder rotations, lifting their arms above their head, starting to do very light shoulder presses, with a small plate and things like that. We're not talking kind of 20 kilo barbell push press or anything. We're talking mobility exercises, but also using resistance to help that and getting the movement by putting your hands above your head. And when you break it down, it makes sense. Yeah. You can't argue against the science of that. And, they are like more kind of, I'm hearing it less and less, which is good. I'm hearing less people coming to me saying that they haven't been able to put their hands above their head. But I have heard it, and I have had it, and I have had people come to me with delays from radio because of the fact that they can't get their hands and keep them there. Yeah. Because of the fact that they've done nothing. But that's what they were recommended.
Frozen shoulder is a shit to treat as well. It's horrible, let alone alongside cancer recovery. It's so painful and so time consuming to get better. It's the last thing you need on the top of trying to recover from something like cancer. So I think absolutely, even just from that perspective, it makes a huge amount of logical sense to me as a musculoskeletal physio that people should be lifting their arms above their head after surgery. Let's go back to some of the other reasons why exercise might be beneficial for cancer treatment. So what about physiologically or immunologically? What are the benefits around that for exercise and cancer treatment? Yeah,
so for example, the drug that I take now, and I've taken now for almost 3 years, it's an immunosuppressant. So I get my bloods checked every single month to make sure that my neutrophils are essentially high enough for me to be able to take the next cycle. We know that there is evidence to show that exercise helps boost your immune system. Obviously, you do have a drug that's going into your body that is constantly squashing it down. So you can only do it to a certain level, right? But if you are staying active and you are exercising and you're keeping your body as healthy and fit as you possibly can, it will help to keep your immune system boosted. And there is evidence that shows that actually exercise helps boost neutrophils. There was a study that showed that literally walking up a flight of stairs before having a blood test boosted the neutrophil count. So it's even things like that. There's certain ways that you exercise to boost your neutrophils. So not doing kind of long endurance sets. So in terms of like cardiovascular things, like not doing, hours of cardio, and keeping your kind of RPE or your rate of perceived exertion around like a 6 or a 7.
So that's like the intensity at which you're working, 10 out of 10 being the hardest and 0 being the lowest.
Yeah, and we're kind of keeping it a moderate when you're going through treatment.
And is that because once you go above that, it actually goes the other way? It starts to cause a negative effect on your immune system?
Yeah, so if you push yourself too high in terms of the intensity, then that's where we then start to get like accelerated levels of cortisol, which can then actually then cause a stress on your body, and actually that sort of depletes your immune system. So it's about finding the right intensity. But if we do find that happy medium, and we do find that nice intensity of that sort of like 6 or 7, which is still higher than people think that they can push themselves, it actually helps to boost our neutrophil count and keep our immune system a lot happier.
So there's a sweet spot, which I imagine is kind of what you're, as a coach now, that's what you're always trying to find, that sweet spot of exercise intensity for someone's immune system.
Yeah, massively. And I learned the hard way as well with like doing it. As I said before, I used myself as an experiment. So when I was going through treatment, there were certain times where I did push myself too hard, and then I felt the effects of it from a fatigue point of view. Massively, I felt the effects of the fatigue from pushing myself too hard. So I always say to people, we exercise, but with the mindset that you have reserves in the tank. So you never push yourself to the point that you feel like you can't do any more. You should always feel like you've still got more left in you, and quite a lot, at that as well. But always thinking that you've got reserves left, and then monitoring how you feel in the next 24 to 48 hours after. And if you feel tired after that, in the next 24 to 48 hours, and maybe the intensity was too much, if you feel good, then you know the intensity is correct.
I love this kind of stuff because it's essentially giving the power to the person and saying, here are some tools to learn how to train yourself as well. I'll be your coach in the session, but I want you to go away and take control of this too.
Yeah, and it's that thing that they can control.
Yeah.
Because they lost control in so many other aspects of their life. You can't control the disease, you can't control the treatment that's treating the disease, but you can control that aspect of your body. And from a psychological point of view, that's a massive win for them as well, because that's that you're giving them that little bit that they can monitor and they can actually do for themselves.
Why do you think psychology is so important? It's quite clear when I hear your story that it was absolutely fundamental to your recovery, and whether it was deliberate or just a part of who you are, it seems to have been a big factor in your recovery. What's your take on that? And then how does that impact on the way you now coach people?
Yeah, I think so. When I was saying earlier about the kind of, there's the physical side of exercise, and then there's the psychological aspect of exercise, and not just exercise, but actually just mindset in general. Exercise helps to then boost that mindset. But I found that whether it's a placebo or not, and I don't think it's a bad thing if it is, that actually maintaining that positive mindset when I was going, and as cliche as that sounds, but throughout my treatment actually helped get through the treatment, but I actually think it helped my body recover. For example, when I had my brain surgery, I was told that I'd be in hospital for probably about 7 days. I walked out of the hospital 48 hours later, and that wasn't by some miracle, and it wasn't, because of the fact that I was fit and young and strong, which is what the nurses were saying. I don't believe that was the case. I believe it was the case because I was so determined to get out of the hospital. It was COVID. I hadn't seen my family. I wanted my mum and dad to see that I was still alive and that I was okay. And I knew that they would be going out of their mind knowing that their daughter has just had brain surgery and they can't see her. So I wanted to get home, and I wanted to be able to, do that for them, but also for myself. So after I moved out of ICU, the following day from my surgery, I said to them then, I want to get the physio down, and I want to be able to prove that I can get out of bed and I can walk and I can go do my lap around the ward that I needed to do for the discharge, walk up and down the stairs that I needed to do for discharge, instead of kind of wallowing, I guess, and sitting in the bed in the ward and giving up. I was like, no, I want to get out. And that's what got me home 48 hours later, not my physical state, not the fact that I was young or fit or anything like that. It was, I believe it was my mind that got me home. And I maintained that throughout my entirety of my treatment. Yeah, there were times where it was very difficult, and there were times where I would cry and I would feel sad and I would think, this is really unfair. But there were very short moments, and I would then try and snap out of that and think, I can't think like that. I don't want to think this is unfair. I want to think this is my situation. So what am I going to do about it? And the way that I would, what I would do is go to my appointments, get my treatment done. And then that saw me then through today. I'm still on active treatment now, but I still deal with it by taking it on and trying to keep as positive as I can in those different elements that I'm faced with. And I think that is what actually has helped me with my recovery, not necessarily my physical state, but actually not sitting at home and not feeling sad or, kind of depressed in that moment, but actually trying as much as I can to kind of change my mindset in how I view it and how I get through it. And I think that kind of has a pretty much a direct effect on my physical state. How it works, I don't know. But I definitely think that there is definitely a link between your mindset and your physical state.
Well, it certainly makes sense to me when I understand the placebo effect as an expectation of recovery, which then actually triggers the healing properties inside the body to begin without any active treatment necessarily needed. Now, yours is not like a typical placebo necessarily, but it certainly is about expectation of effect or deciding that you wanted to be in a more positive, optimistic frame of mind for recovery, which there's a whole branch of medicine now called intentional medicine, which is the intent to recover.
Yeah.
And you're a classic example of the power of that. You've essentially shown that by being optimistic, by being active and positive towards recovery, you've managed to completely defy the logic and the medical advice that you should be dead now.
Yeah.
You're currently absolutely alive and with vigor and vitality sitting right in front of me and talking the tale of the benefits of mindset. So, whether we know the exact biological underpinning between the two of us, which we don't, we just know that it works. Placebo is absolutely a thing. It's something that is proven to be sometimes as much as 50% of the effect of healthcare, and you're right there and living it. So I don't think there's anything contentious to say that anymore. A great book I read last year by Gabor Mate, I can't quite remember the title, it's something to do with the hidden cost of stress or something to do with that, but it talks a lot about psychology and mindset and how it can go two ways. It can be used for recovery, but also it can cause illnesses as well. I think it's the hidden cost of stress maybe, but you're almost the antidote to that, the opposite of what happens when you optimize the mindset and get the best from it. And it sounds like you were able to experience the emotions, because there was something around that as well, that you don't want to deny yourself the experience of the emotions, because actually it's healthy to be angry and frustrated and sad. And like, why wouldn't you be? Like, that seems, if someone's telling me that they don't feel those, that sounds abnormal.
Yeah.
Right? So you did feel that, you did experience those emotions, but what you were able to do is then choose a different path once you decided it was no longer beneficial to you.
Yeah.
You needed to get yourself into that kind of optimistic frame again and be more proactive. So was that intentional from you?
Yeah, I would say that it kind of, I always, from the very get-go, I remember friends of mine saying to me that they didn't know how I was dealing with it. That's what everyone said. I don't know how you're dealing with it. From getting the news, and it happened very quickly, from initial diagnosis to then getting my stage 4 diagnosis to then getting into brain surgery. It was less than 4 weeks. So all of that happened in kind of like a month span. And I think it's probably very expected that maybe in that time I would break down, and I wouldn't be able to function mentally because of that. But I actually did the opposite. And I think that's what people kind of initially found bizarre. because they were like, well, how are you dealing with this? Why do you seem so normal? And I wasn't normal in the sense that I wasn't feeling my emotions. I was, I cried and I screamed and felt angry, and I dealt with that in the time, but not necessarily, like, I haven't always been like that either. But in that moment, I just knew that I couldn't continue that. That wasn't going to help me. What was going to help me was if I actually, it's the kind of the fight or flight thing, right? Like, I knew that actually what was going to help me in that moment was for me to just think, okay, what do I need to do now? And then take every single step as it came as just one step forward. So, for me, it was going into surgery, having that, okay, what's my next step now? Well, it's getting home. Let's go. When I got home, what's the next step? Prehab for chemo. Let's do that. What's the next step now? Start chemo. And it was just kind of those little steps as I went along. I was never seeing it as a bigger picture. And I wasn't seeing it as, where am I going to be in 12 months' time? Because that's far too overwhelming and no one knows. No one would have known that 12 months later I was going to be cancer-free. But in that moment, I just saw one step as it came, and that's what then helped me to actually break it down, I think. And that's what I then project onto my clients. And that's what I try and get them to see when they come to me, and then they say to me, I used to be able to do this and now I can't, and I want to get back there. And you can see the frustration and the upset that's caused by it. I said to them, okay, well, don't think about you want to get back there. Let's just think about what's the next step. What's the first step that we can take that potentially is going to get us there, but we're not going to think about that yet. We're just going to think about what's the next step in front, and mentally just kind of making it a lot smaller to compute and to actually think about helps the recovery phase a lot better, and actually then helps you to kind of see it as, more like something that you can process. You can mentally process that. You can't process everything that has happened, plus everything that you've lost, plus, how am I going to get back to where I used to be? And you actually find that by kind of breaking it down into smaller steps, they will get back to where they used to be, even if they didn't think they were going to.
So it's another parallel to my world, is that if you only focus on long-term goals, people see it too far away.
Yeah.
And they get lost, and they often don't meet those. So if you break it down into those smaller chunks, those smaller progress wins, those, hey, look, you're doing 2 kilos heavier than you were last week. That's fantastic news. Yeah. Last time you did this weight, it was really painful. Today it's not. So,
yeah. Exactly.
So those bite-sized chunks gives them a sense of progress and a sense of victory. Do you ever, or maybe we'll go first for you, did you ever sense this longer term goal for you? Was there this, I'm looking far into the future of my recovery, but to keep it manageable, I'm going to make it short term process oriented?
Yeah, I knew that I always wanted to get back to CrossFit.
Okay.
I knew that's what I wanted to do.
That was your moonshot. It's like, I'm going to really go crazy and think ambitiously.
Yeah.
However, this is my understanding of it. You need both.
Yeah.
But your main thought process is short term.
Yes. Yeah. Because I knew that I just started to get into CrossFit before I got diagnosed, and I was having fun with it and I enjoyed it. And I knew that I wanted to get back to doing that. And that was kind of my end goal, was to get back into the gym and start lifting again with a barbell, and, start learning to do gymnastics again and things like that. But it was impossible for me to actually think about that in that moment of time, because I didn't know how treatment was going to go. So all I knew is, well, I've got an assault bike in my flat. That's kind of CrossFit. And, I've got a few bits of kit that I can do some CrossFit style movements to keep that baseline. But in that moment, the exercise changed for me from kind of a drive to being a good athlete to just being kind of to survive, essentially, in that time. But then from that, I hit my goal. I'm back to doing CrossFit. I'll be back to competing this year. And that's the exciting thing. But I never try to let myself kind of get frustrated or see that end goal, because, as you say, it's too overwhelming to kind of view it like that. But that was kind of something that I wanted to get back to, but it was just more of a case of, we will in time, but I'll take it in small chunks.
There's this continuum that I've been thinking about with some colleagues quite a lot recently, of this suffering section, a surviving section, and then a thriving section. It sounds like a big part of your early stage was going from suffering to surviving. And although you were dreaming about thriving, it was just making sure that you could go from suffering to surviving.
Yeah.
And then perhaps from what you're saying, you were then figured out you were surviving, and then you were able to transition towards thriving.
Yeah.
So where are you now? You thriving?
Yeah, I would say so. And I like that word. It's a word that actually is getting used a lot now in the cancer world. We don't refer to people as cancer survivors anymore. We actually refer to them as cancer thrivers.
Amazing.
And it was that complete shift of you don't necessarily survive cancer, because that also then means that kind of has connotations of, those that we have lost didn't survive or didn't win, that kind of thing. And that's not what we want. So we kind of moved away from that, and it's not the fact that we have survived it, but actually that we're thriving, because sometimes people haven't necessarily survived it because they might still be living with it, and that's also fine. I've got people that I work with who are actively living with cancer, but they're still thriving. They're still traveling, they're still coming and training with me, they're still doting on their families, they're still probably doing more now than they were actually doing before, because it gives you a complete new appreciation of life. And so that kind of thrive element, I like to think that that's where I'm sat. I've kind of gone through that survival phase of let's get through treatment and see where we come out the other end of it. And the fact that I'm still on this planet, it gives me now that opportunity to try and thrive, and to live my life as best as I can. Well, I'm obviously, I'm still on active treatment and everything, but a lot of people look at me and think, like, well, you don't look like you're on treatment. And that's another huge thing as well, that cancer patients don't look like cancer patients, like how you kind of expect people to look. You probably look at all of my clients that I work with and think, well, they don't look like a cancer patient, but what does that look like? We don't all look really kind of frail or unwell or anything like that, because, well, modern medicine, but then also the fact that I think that's just a kind of a viewpoint that probably was portrayed in the media, and a lot in films and TV, and unfortunately some of the adverts and things like that you see, but actually that's not what we look like, hence why we don't need to be wrapped up in cotton wool, kind of going back to that same point. We are thrivers in our own right, whether we're living with cancer or have lived with cancer. We're not kind of what you probably, or what people maybe potentially view us in the media.
And the cancer viewpoint, the cancer mentality, or people sort of see cancer as an old person's condition, or a bald head because your hair's fallen out.
Yeah.
So has that, do you think, almost supported the view that cancer thrivers shouldn't be considered as thrivers? They should be protected and wrapped up in cotton wool. Do you think it's this kind of slightly warped viewpoint and lens that we're looking through that means that that's why a lot of people do get it wrong?
Yeah, I think so, because I think when you think of cancer, you probably do think of someone that's like, 60 plus. My breast cancer, when I was first diagnosed, my consultant said to me, oh, you've got the old lady type. That was the first thing that he said to me. I was like, what does that mean? The old lady type. And, that I'm living proof that low risk doesn't mean that you don't get cancer. And the more that I actually spoke out about it, the more I realized that there are so many young women that have been diagnosed with cancer under the age of 30. Yes, we're rarer, but there are so many of them out there. And not just breast cancer, but I've got people with ovarian cancer and bowel cancer that are incredibly young,
and healthy.
and and
fit and strong.
100%.
And no family history.
No. Yeah, exactly.
Because ultimately this comes back to your diagnosis or misdiagnosis to begin with, the incorrect reassurance that everything's fine, because they just stereotyped you as as not having enough of the risk or not having any of the risk factors. But as you've just quite rightly said, low risk does not mean zero risk.
No.
And, kids get cancer.
Mm-hmm.
We are aware of that. And they don't have lifestyle that's essentially increased their chances of cancer. They just, unfortunately, have been unlucky with their genetics.
Yeah.
Or a random mutation that has skipped through the net. Because the other thing we haven't spoken about yet either is that we all have cancer cells at some point in our lives.
Yeah.
But most of the time, our immune system is pretty effective at getting rid of it. Every now and again, it just fails, there's an error. And these mutations happen more often when we're older, and our immune system becomes less effective when we're older. So hence why it exponentially increases as we get older. However, as we've just said, it's not zero risk. So then we come back to your diagnosis. I think it's absolutely important that you keep shouting about the fact that young, healthy people get cancer too, and that although there is a connotation attached with, scanning everyone and then having false positives, for example.
Mm-hmm.
There is that. We're aware of people having a scan and a lump being diagnosed as cancer incorrectly. That can happen. And there are some mental health problems that come with that, some stresses that come with that. But surely that's better than the other end of it, where you underscan and miss potentially life-threatening cancer.
Yeah.
So it just takes the skill of a clinician to be able to communicate these factors from the beginning. That seems more important to me.
Yeah. Yeah. And I think the saying that I said at the beginning, and I've kind of always said throughout, is that cancer doesn't discriminate. So why should medical staff?
Yeah.
Why should we? It doesn't matter as we say, your lifestyle, your age, your genetics, anything like that. Cancer can happen to anyone. It literally can. And I've seen it, and I'm living proof of that. So as a human race, we shouldn't then prejudge that. You should be actively checking yourself from a young age. We should be teaching kids about that from school. I wasn't actively looking for my cancer. I just by chance found it. It was actually my cat that found it because he was padding on my chest and it hurt. And then I thought, oh, what was that? And so, in that moment, that it was just lucky that I actually had found it. But unfortunately, it wasn't lucky that, yes, I then did get prejudged on my age. And we are seeing it younger and younger of people that are getting these cancer diagnoses that are typically found in older people. You tend to find that pediatric, like children that have it, tend to be kind of more sort of like leukemia or Hodgkin's or non-Hodgkin's and things like that, which tend to happen in a younger age. But then, breast cancer, bowel cancer, pancreatic cancer, ovarian cancer, these different things that tended to kind of be deemed as older people's diseases, they aren't anymore. We are seeing it more and more in people under the age of 30. So we need to be looking out for the signs, but we need kind of the society and also medicine and, doctors to be kind of very aware of the fact that this is happening. So if, someone does turn up with a lump, get it scanned and get it biopsied. And again, not tarnishing everyone. Like, there are young people that have gone and have been tested and have been found, and that's great.
Well, even when I was a teenager, I found a lump. I had a testicular lump, a very small one, and I was very scared. I told my mum. I remember it being a bit scary for me and not really knowing what to do about it. And went to the doctors, and they said, it's probably nothing. We can't really find much, but let's send you for a scan. I had an ultrasound scan, and they said, you're fine. You're absolutely fine. We've checked it. There's nothing wrong. And that was it. It felt, okay, you took me seriously, and there was nothing wrong.
Yeah.
So that seems like the right way of doing it. And had they have found something, I'm sure they would have then got on to the next level of investigations.
Yeah. Yeah.
So, that I wasn't really the right age for that either, but they still took it seriously and listened. So like you said, they don't always get it wrong.
No, they don't always get it wrong. And, there are lots of instances where they get it right. And that's a good thing. They get it right and they test it. And then, either yes, it's something that they need to investigate, or no, it is that you're fine. But then there are the cases that, they aren't looking as thoroughly as they potentially should do because of your age or lifestyle or anything like that. So you've kind of got the two sides of it. But I think that the more we actually just kind of deem any lump as suspicious, potentially, is probably the better way to be. And it's not it shouldn't be causing fear and worry where it's not needed, it's not necessarily that, we're not looking for cancer. I say that to people as well, that you should be checking yourself on the regular, but you're not looking for cancer, in the idea that it's going to come one day, so you need to be aware of it. It's not that, because it doesn't happen to everyone, but we do know it does happen to 1 in 2 of us, and the statistic is high. So it's just being more aware of that and just making sure that you are aware of any subtle changes in your body. You know what's your normal, and then potentially what's not your normal, and then not being fearful and not being embarrassed to go and get it checked, if you do find something that's not your normal, essentially.
And one of the other factors that seems to be quite unusual almost for your case is that you're on a specific medication that tends to essentially start to cause its own problems within your body, let alone the cancer, this medication itself, the immunosuppressant. So can you tell us a bit more about that and what your thoughts are around why you seem to be coping so well with it?
Yeah, so I take a drug called abemaciclib, and it's basically a drug that is a targeted therapy drug. So it's not immunotherapy, but it basically targets the cancer cells. So it blocks your CDK3 and 4, which is a protein that causes cancer to grow. And the drug itself blocks that from being produced, so essentially stops the cancer from being able to grow. And I hold a lot of faith in that drug, in part of the reason why I became no evidence of disease, because when I finished chemo, I still had cancer in my body. I started that 6 months later, it had gone. So I do hold a lot of faith in that drug, but tends to be that people are on that for kind of an average lifespan of about 9 months. And it can be for 2 reasons, or 2 main reasons. One, the fact that you stay on it until you essentially can't live with the side effects anymore and it becomes too debilitating in your everyday life. So one of the main issues with that particular drug is gastric issues. So a lot of people get really severe diarrhea with it and have to take Imodium with it regularly. And it can cause kind of all sorts of issues because of that. And then there's the other side of it as well, that we know that cancer is very clever, and cancer mutates, and it learns how to mutate around drugs, which is why we've got so many different types of chemo drugs, because some work, some don't. So that's why we talk about kind of the different basically trials of treatments that we've got as well, because one may stop working, so then that's why you then need to go on to another one. But this particular drug has, usually an average of about kind of 9 months, but I'll have been on it for 3 years coming up in May. And so it's kind of a bit of a head scratcher, I think, for a lot of people as to why I've been on it for so long. But I am a firm believer that it kind of all goes back to what we were saying at the beginning, that the research shows now that if you do maintain a physical lifestyle and you do exercise and you do remain healthy in that element of your life, then your body will actually respond better to the medications. And I've never had any side effects with this drug, so I didn't get any of the gastric issues. Became allergic to eggs. That was the only thing that's actually changed, and they've put it down to that. But other than that, I haven't had any of the real side effects that you can get from it and that they warn you about. And I still, even though I'm still on it and it still kind of does cap me a little bit in terms of my activity level, I'm still able to hopefully compete in CrossFit this year. I still am able to push my body hard even though I am on this drug. And I think it all kind of comes back to that, to be honest, the fact that I never stopped with my activity level, and I've always tried to keep myself as fit and strong as I possibly can. In an educated way, and kind of knowing that some days I'm a little bit more fatigued than others, and so I will change the way that I train and take the intensity down, because fatigue is one of the side effects of it as well. But on that, I never fatigued when I went through chemo, and that is kind of the number one side effect that they say that chemotherapy causes. But I never fatigued in chemo. I haven't fatigued in taking this new targeted drug either, and that is kind of one of the main things that research shows, that exercise really helps with fatigue. They say if you're feeling fatigued, go for a 10-minute walk, you'll feel a lot better, and 9 times out of 10 people do.
Or go to the gym and lift some weights.
Yeah, all that.
Do a bit more.
Yeah. At a correct intensity level, yeah.
Of course.
But yeah, and I think that it's kind of speaks volumes really that I live the lifestyle that I lead and that I'm on this drug for almost 3 years when actually kind of they predicted maybe 9 months, if that, for it.
It seems like that fatigue element actually could be more important than I'd even considered before. But the more I hear you say it, the more I'm almost connecting the fatigue with a sense of helplessness, and that sense of helplessness then leading to that almost expectation of failure, and therefore not able to be optimistic, positive, and enhancing that intentional medicine concept. So, do you think that's where exercise actually has even more powerful benefits of just preventing fatigue and therefore feeling hope?
Yeah, 100%, because you break the cycle. So if you kind of think about fatigue as a cycle, if you start off fatigued and then you remain sedentary because you feel fatigued, we know that remaining still actually worsens fatigue. So you've got someone that's fatigued, doesn't move, and then gets more fatigued because they've not moved, so then doesn't move, and then gets more fatigued, and you're constantly
downward spiral.
Yeah, exactly.
Downward spiral.
So it's just constantly spiraling, and the only way that you can break that is then by introducing activity. So that's why I say about kind of just taking like a 10-minute walk. If you're on the sofa and you think, I am so fatigued, I can't even brush my teeth, which happens, get up and just try and walk around your flat a little bit. Or, you know, I had some resistance bands in my flat, and I would just kind of literally just do some like bicep curls with a resistance band, or do some sort of like, you know, banded pull aparts and things like that to kind of activate and feel that I was doing something, and then it would always make me feel better. And we know that endorphins are produced when we exercise, so that helps with then the fatigue side of things. But then you break that cycle, and then you can do a little bit more, and then a little bit more. So it's just about trying to break it and do something small at the beginning, even if it is just a 10-minute walk, and then from there building the steps. And then you'll find that actually over time you don't fatigue, or you fatigue significantly less than what you were doing before. One, because of the fact that you're actually kind of boosting the endorphins, but also I think it's just from the fact that you are making yourself physically stronger. And then it all links back to that positive mindset as well. The fact that we know that kind of, you know, I got put on an antidepressant when I was going through treatment, which was basically to boost my serotonin levels, because they thought that my serotonin was low. We know that exercise helps boost serotonin. And, you know, I think that's something that has massively helped me in remaining this kind of like positive person that people see, which I'm sure to some other people is like really annoying, because they're like, why is she not sad? But I just think a lot of it is just the choices that I make, and the fact that I do, you know, remain as physically active as I can, because I know that it's going to help me boost my serotonin levels, and then it's not going to make me fatigued. And fatigue is horrible, and it's chronic, and, you know, it's not just tiredness. When we talk about fatigue, it's not feeling tired, because sleep doesn't help. You can nap all day long and you will still feel fatigued. The only way that you can actually break it is by moving, and it kind of seems counterintuitive, but actually, it's true.
But actually, it's another universal principle across health. We do the same with chronic pain.
Yeah.
We do the same with chronic fatigue syndrome. We do the same with depression. Graded exposure to activity, graded exposure to more challenging situations improves outcomes. And you've just explained it perfectly there. That's exactly it. It's that graded exposure concept to break the cycle, break that downward spiral concept, because ultimately fatigue is something that your brain, your protective system is using to protect you.
Yeah.
Quite often it gets it wrong. So it's using it to slow you down, when actually what you need is to build back up again. And it happens a lot of the time, and it's a very common experience of people in lots of different domains, as we've just explained.
Yeah.
So you're describing the solution to fatigue, not necessarily the solution to cancer recovery. And it seems to be the same. So again, it's this wonderful universal principle that exists within our world. There's obviously specifics about the job you do and the specifics about the job I do, but it's so great to just hear that good exercise seems to be universal.
Yeah, they're very linked.
Yeah,
there's very much a linked flow in between the two.
What I'm keen to just to learn about now is, you've spoken about your general mindset, your general exercise routine, but what does actually a week look like for you? What do you do?
So my general week consists of kind of balancing a lot of balls, I would say. So I've got kind of obviously my job side of things, which tends to get me up quite early, and then I'll see clients in the morning. So those people that maybe potentially are still working, I'll see them in the morning. Those that are on treatment, I usually see them sort of mid-afternoon, when their energy levels tend to be highest around like lunchtime, particularly those that are going through chemo. And then I've then got evening clients as well. And then in between that is then when I then train myself. So I tend to kind of like train in the afternoon. So kind of like my Monday to Friday essentially is a bit of a mixed match of clients in the morning, train a little bit myself, have some lunch, do some more clients, and then I tend to try and get a walk in every day, get some fresh air if it's not raining, and then more clients in the evening. I work a lot, and I know that I work a lot, and kind of like people at the beginning were kind of concerned about that, or I say people, my family, because of the fact that I am still on active treatment. But I love my job so much that I think, you know, the saying is that if you love your job, then you don't have to work a day in your life, and that is kind of how I view my job. I love seeing the progress that people make and the difference that it's making to them and their treatment, and I love hearing the news that they've got clear scans, and we've had a lot of that recently, which has been incredible. And yeah, so I would say probably 70% of my week is working with cancer patients or people that have gone through cancer. But I don't see it as a job. It's not a chore for me. It gets me up in the morning, and I love it. It's what I'm passionate about now.
Almost sounds like you're happier than you were before.
Yeah. I think before I was always looking for something new. So even though I really enjoyed the strength and conditioning side of things and I enjoyed working with athletes, I was still looking for something. So I'd applied for university again, 3 times. I'd applied for university again before I was diagnosed with cancer. I applied, got in, decided I didn't want to do that. Applied, got in again, decided I didn't want to do that. Actually then applied for physiotherapy because I thought, oh, maybe I'll go down a physiotherapy route. I was always trying to find something, but I just don't think I knew what that thing was. And, you know, if you had said to me kind of 5 years ago, oh, you're going to specialize in cancer and oncology exercise, then no, there's zero chance. One, because I didn't know that it actually existed, but there's no way that I ever thought that my kind of calling in life would be to do the job that I do now. And, you know, it probably wasn't until I went through it myself. And that's why, you know, I am doing what I'm doing now, because I'm living proof of it and I know how it feels. And the benefits that it can have on the human body. But I know I'm not looking for that something new. I'm now very happy with what I'm doing. And I can see a very like bright future in what I'm doing, and it excites me to be able to expand what I'm doing and to give people more access to, you know, the services that I provide, and kind of doing things that potentially weren't already out there. So, you know, I've got clients in the States, I've got clients in Switzerland, like, and we train together but using video calls, and that's not really something that was accessible before. And so now it's kind of that excitement of how can I build this, how can I get this bigger, how can I form a team and, you know, get this actually accessible to everyone that is out there. And then on the other side of it as well, how do we get this as part of treatment in hospitals? You know, you've got your physio team, where are your cancer exercise team? And that's kind of the end goal for me in terms of my job, is to try and get there at some point and actually have it so that when you are diagnosed with cancer and you know that you're going to have like physiotherapy after surgery, but then actually you should also know that during your treatment you're going to have an exercise specialist that's going to give you advice on what exercise to do throughout your treatment so that you don't get fatigued and you don't feel the full effects that cancer treatment can have. And also you don't feel lost. I think that's a massive thing, that a lot of people feel lost and hopeless, whereas actually giving them control of their body by using exercises, that they then don't feel as hopeless, and actually gives them, hope.
Yeah. Sounds like cancer helped you find your purpose, which is almost, sounds like it shouldn't really be the case.
Yeah. It kind of, it gave me the light in a very dark situation, I think.
I think that's testament to you and your mindset, but it, hearing it now, it's clear that, you found your calling, which is amazing, but your mindset clearly helped you to find that. It helped you to discover that as well.
Yeah.
And you mentioned that just before your diagnosis, you'd started to explore CrossFit, and you're now a CrossFit athlete, and you're sitting in front of me looking athletic, looking strong, and looking powerful. Has it always felt that way about, how your desires around exercise, because you used to be an endurance athlete, you said.
Yeah.
So how has that shifted, and how do you come to terms with that change?
So I think, so before I went through all of, the diagnosis and everything, I was very much a string bean. I'd become very lean. I had a 6-pack, and I was very fit. I could run miles, and I probably would say at that point I felt the most athletic that I'd ever felt in my life. And then it did take a shift when I then went through treatment, because the access that I had to the kit in my house was more of a CrossFit style. So as I say, like the weights that I had and the assault bike and things, and I couldn't really go outside for a run or anything like that because I was shielding, so I wasn't allowed to leave the house because I was having to stay inside during COVID and my treatment. So it took a big shift from there, and then when I then came out of treatment and gyms reopened, and then I then started a CrossFit box, and then I found my love for that. But the shift in what happened to my body was something that I had to kind of very much come to terms with. So I look very different to how I looked before. A mixture of cancer treatment not helping things as well. Like I did gain a lot of treatment, a lot of weight through like steroids and stuff like that you have during treatment, but also just the fact that my body physically looks very different as a CrossFitter as it did as an endurance athlete. So bigger legs, bigger shoulders, bigger back, that kind of thing. And for someone that I have had history of an eating disorder when I was a teenager. That was a very difficult thing to come to terms with, seeing my body getting bigger, because that kind of, the gremlin, as I describe it, that is there, that sits on my shoulder and sometimes is louder than others and sort of, tries to kind of basically say that, oh, you're getting bigger because you're getting fat. That's what it always said, because that's what, I always used to think when I was a teenager. Instead of actually, no, you're getting bigger because you've got a ton more muscle mass than you used to do when you used to run marathon. And so that kind of like shift in the aesthetic point of view was something that I found very difficult. I think as well, kind of, I know that I can't run as long as distance as I used to be able to run. Because I'm just not accustomed to doing it anymore. I run as part of like CrossFit WODs. I don't run half marathons on the weekend. And so then that was something that I struggled with at first, because I thought, I've lost my fitness.
Yeah.
But I haven't. It's just, I can now empty myself doing some kind of like WOD that, at a competition. But, and I wouldn't have been able to do that before. So it was just a very much a different shift of sport. But I'm happy with the shift that I made, because I feel like I thrive a lot more in CrossFit, and I'm a lot stronger than I used to be, which helps with, even things like my back. I was still coming out of kind of rehab for that, and I haven't had any back issues really since, because I've just built up the foundations around it. And I also think kind of from a mental perspective, coming out of having a cancer diagnosis, CrossFit has massively helped me to appreciate my body, because when I throw a barbell overhead and I catch it and I can, land that lift, I feel strong and I feel powerful, despite knowing everything that I've been through. And that to me means a lot more than before, like the
Yeah.
sport that I was in before.
Yeah, again, another powerful message, isn't it, of mindsets like, despite spinal surgery, despite cancer, I'm still being fucking kick-ass and lifting heavy weights and smashing all sorts of CrossFit shit.
I
So
try.
it's so cool. It's so great to hear. And we didn't really speak about the spinal surgery so much, but even that is there's a big connotation of, now you've had spinal surgery, you need to protect your back. And you've said no. I've had your spinal surgery too, and I have a very similar mindset as well. I lift weights, run marathons, and do what I want, and I enjoy life. I played rugby for 3 years afterwards as well. It was on my terms. I quit rugby, not on my back's terms.
Yeah.
So that gremlin wasn't going to win. It was me. So So it just takes a mindset and an acknowledgement that the body is pretty cool if we give it the tools in order to recover from these things. And I think that's essentially the message I'm getting from you, is that you made some really amazing choices to choose recovery. And it's not to say that everyone can do that and be successful, but if we talk about risk again, I think you can considerably increase your chances of recovery when you follow a mindset that you've essentially celebrated and talked about through this talk. So I'm really, really pleased to hear that things have obviously worked out so well for you. So thanks for sharing your stories with us. Got a couple of things just to finish on, and I almost feel like I know the answer, but this podcast is called the Better Never Ends podcast. What does that mean to you? What does Better Never Ends mean to you in your life?
I think for me, in terms of like the better, it would be now kind of the mission that I've got in terms of changing the way that we view cancer patients and changing the way that we treat them throughout throughout their entire experience. And I like to think that is never going to end, but actually it's only going to keep improving. Because we're starting to now see that shift of, we're not frail, we're not weak, and we're not vulnerable, but actually we can be strong and we can be powerful, and we can, as you say, we can still kick ass. And I think the more that we get that message out there, and the bigger we grow that, and the more that we see it, the better it is for everyone, but also the longer we're actually going to live, because we're going to actually stop wrapping people up. We're actually going to start pushing people a little bit and actually getting them to move their bodies and to become fitter and healthier, despite the fact that they're going through what they're going through. And actually from that, we can get them to live longer than potentially what they were going to live before. Both from a physical and a psychological point of view.
Wonderful. And if someone wants to find you, Fran, where would they find you if they want to learn about your story or work with you?
So I've got a website, which is just franwhitfield.com. And then on there is kind of, you can read a little bit about my story. And then also there's a page on there of like how to train with me, and the different avenues of that. And then also you can read more about my story on my Instagram, which is just Fran Whitfield. And then I'm very much open about my story and everything that happened, and also everything that continues to happen, because there's always something that gets thrown up in my life, as it does with cancer treatment. There's always something new. So I am very open book on there as well, and that's how a lot of people contact me actually, both through my website and also through social media.
You mentioned that you became a bit of a geek during your recovery. If someone else wants to become a bit of a geek, what kind of resources would you point them towards? If they want to learn a bit about cancer and exercise, improving cancer, what would be the best thing?
So in terms of kind of like, if you actually want to go through the really deep learning, so the qualification that I had is through an organization called Cancer and Rehab, and they've been around for quite a long time, but not that many people know about them. And that's where you can learn a lot about kind of like the benefits of exercise through your cancer treatment, and that's who I then actually end up doing my qualification with. But I would also always say that when you are researching, always read classified research papers. Don't just kind of read WebMD or Dr. Google. Don't ask Dr. Google, but kind of dive a little bit deeper and actually start reading into actual research papers that are showing the effects of the exercise that we're doing on the various different treatments that we have. And I say that for everyone as well. That's even like when they get diagnosed, never read Google. Don't ever search Dr. Google or forums and things like that, because everyone's got a different opinion. Particularly when you're going through your own cancer journey, it's your cancer. It's not someone else's cancer, and what you're going to experience is very different to what everyone else experiences. So I always kind of think go through the actual research route and not Google as such.
Own it.
Yeah.
Own your own cancer.
Yes.
Okay.
Yeah.
Okay. Thanks so much for today, Fran.
Oh, you're welcome.
Really
Thank you for having me.
Thanks. Thanks for listening to today's podcast. This podcast is sponsored by Better, provider of health, wellness and performance services based in central London. You can book in for face-to-face services at either of our 2 clinics, one in Soho and one in the city. You can also follow us on Instagram at Better Never Ends, or head over to our website for more information about the clinics or the podcast at www.betterneverends.com. And of course, if you want to send us an email with any feedback, questions or suggestions for future episodes, then email us on podcast@betterneverends.com. And finally, thanks to Brian Long for editing the show. Without him, it's absolutely no doubt in my mind that these would never have seen the light of day. And it will allow this podcast to continue on for as long as I'll keep recording them. So thanks very much, Brian.